And by the growing number of flu cases, some hospitals are seeing up to 5 times as many cases as last year. And young children and older adults are the most at risk right now. And joining us now is Dr. Emily Boss. She's a pediatric ENT at Johns Hopkins. Dr. Boss, always good to see you. Thanks so much for joining us. I know it's been a busy time. What are you seeing right now with flu cases and hospitalizations that makes today feel different from a typical flu season you've seen?
We are definitely in the heart of flu season. There is a lot of flu intensity in Maryland and DC and really across the nation. We're seeing a large amount of patients present in the outpatient setting, and also we're seeing many hospitalizations and serious complications of flu.
Yeah, we've seen from the health department those numbers. They're pretty alarming. There's a lot of talk also about whether this year's flu vaccine, works this year. I know it's always hit or miss, but the bottom line is, even if it's not a direct hit with the certain virus or the strain this year, it's still pretty good to get that, right? Because it limits severe case in hospitalizations.
That's absolutely right. The flu vaccine, it's not a perfect match, and the flu vaccine's never a perfect match, but we are seeing that there's protective benefit, particularly against those hospitalizations and serious complications of flu. And we also know that there's some protective benefit in that some people who get the vaccine are not getting the flu that otherwise would. And it's really important because we want to prevent spread of the disease to more vulnerable patients. Some people can get the flu, you feel terrible, you get a fever, you get body aches, you have cough, runny nose, and you improve at home. But others don't, just like you were saying. So young children or adults with asthma or other underlying lung or neurologic disease, or older adults are all at higher risk of having a complication of the flu and requiring hospitalization. That's where preventing the flu with a vaccine is really important, and also reducing the severity of those complications.
If someone in a household starts showing those symptoms, what steps should they take immediately? And are there any common mistakes that people make that you think we should avoid?
So a couple things. One, if somebody in the household has a fever and has a cough and these other symptoms like the body aches or runny nose, it's a good idea to get tested. And the reason is you could potentially be eligible for prescription antiviral treatment, and that treatment needs to be started within 48 hours of symptom onset. So and the antivirals do help reduce the severity of the symptoms, and they do help keep people out of the hospital. Then the other thing is, of course, stay home. If you or somebody in your household is sick, stay home until everybody is fever-free for 24 hours without any medication. Of course, all of the usual. Practice really good, meticulous hand hygiene, disinfect surfaces, protect your cough and your sneeze, and just be very aware of the environment around you and spreading the disease.
And real quickly, not too late to get the flu shot?
Not too late to get the flu shot at all. We are really in flu season, and it's going to last for several months. Even after we reach the peak, which we don't know exactly when that will be, we'll still see flu. So it's a great time to go get the flu shot now.
Okay, great. Dr. Emily Boss, thank you so much.